So today we're going to talk about why it's important for people in a number of different fields to understand the substance troubled person. Chapter 1 talks about the role of mental health professionals in both prevention and treatment. And what is that role? What is the role of a mental health professional in the prevention and treatment of substance use disorders? We're going to talk about it in a couple of different ways just to help you think about it differently. We're going to discuss generalist training and why it's important, even if you're not in a specific addiction field, philosophical orientation, professional orientation, as well as really delving into your helping attitudes and beliefs. So first, let's take a look at generalist training. And what is generalist training? So it could be substance abuse counselors. It could also be marriage and family therapists, social workers, school counselors, or clinical psychologists. Essentially, alcohol and drug use affects a number of areas. Therefore, there is a need for generalist training and just having a generalist training model. So to illustrate the importance of this, let's take a look at the examples in your book. If you go to page 2 in the very first chapter, there are situations that are outlined where helping professionals that are not involved specifically with substance abuse treatment needed information and skills in alcohol and drug field to perform their job functions completely. So I'm going to go through those with you now. Some years ago, one of the authors of the text was asked by a local school district to conduct an independent psychological evaluation of a 14-year-old student who was a freshman in high school. The young man's parents were dissatisfied with the school district's evaluation of their son and had asked for another opinion. The youngster was failing most of his classes and was skipping school frequently. The parents were quite sure that their son had a learning disability that would explain his difficulties. The district school psychologist had tested the student and not found a learning disability. The school counselor had suggested that there may be an emotional problem and recommended family counseling. In addition, a weekly progress check was initiated at the school so that the parents could keep informed of assignments and homework that their son needed to complete. They had also hired a tutor. However, none of these interventions seemed to be helping, so the independent evaluation was requested. In reviewing the test information, no indication of a learning disability was found. An AOD assessment, which we're going to discuss later on in Chapter 6, was conducted, and there was evidence that the young man had been using alcohol and other drugs on a daily basis. The parents said that they allowed their son and his friends to drink in their home because they believed that this would prevent them from using drugs and from drinking and driving. The parents were defensive about their own alcohol and drug use and rejected suggestions that the cause of their son's problems could be related to his alcohol and drug use. A couple of months later, there was a request for the young man's records from an alcohol and drug treatment program. He was referred to the program following an arrest for stealing alcohol from a convenience store. The second example was one of the authors of your book, supervising a master's student who was in a marriage and family therapy internship. The intern had been seeing a family of 4, mom, dad, and 2 children. The ages were 3 and 9. They were referred to the university counseling clinic by Children's Protective Services. A child abuse report had been filed at the 9-year-old's elementary school because of bruises on the youngster's face. The father explained that he had slapped his son because of his frustration with the boy's behavior and backtalking. The parents complained of frequent conflicts relating to parent techniques and family finances. The intern had developed an intervention plan that included referring the parents to a parent education program, as well as working with the family on communication skills, including iMessages and conflict resolution procedures. The intern was frustrated because the parents had failed to follow through on the parent education classes and had not made much progress in improving the communication patterns. It was suggested that the intern assess the AOD use of the parents, and she did so at the next session. The mother and father had a heated argument about the father's drinking. They did not show up for the next appointment. And when the intern called, the mother said they were discontinuing counseling because the father said it was a waste of time. Finally, there's another example of a social worker who's a woman in her 30s with depression. We regularly consult with a social worker in private practice. One of the social worker's clients is a woman in her early 30s who sought counseling for depression. As you can see in your text, depression is in quotes. The woman had been married twice and described a series of failed relationships. Her first husband was an alcoholic and the second was a poly drug abuser. For 2 years, she had been living with a man who was in recovery from cocaine addiction. However, she found out that he had been having numerous affairs during the relationship. The woman, who has a master's degree, could not understand why she continued to become involved with this kind of man. She felt there must be something wrong with her because the men in her life needed alcohol, other drugs, or other women. Her father was an alcoholic and verbally abusive, and she had also been sexually molested by her paternal grandfather. In these 3 situations, the professionals were not involved in providing substance abuse treatment, but they needed some of the basic skills from the alcohol and drug field to perform their job functions well. What I really want you to understand or take away from this is that today, the prevalence of substance use disorder in society necessitates anyone working in a helping profession, which means working with people in general, need to have a basic knowledge of the alcohol and drug field. So next, we're going to take a look at the addiction tree. I'm sure that some of you have seen this before in a variety of different ways. This is just one that I particularly like because it shows the root system. So the addiction tree is just a way to show how addiction works. The trunk is substance abuse, and the branches are the multitude of other problems caused by or related to the substance abuse. As illustrated in the 3 scenarios in your book, you can see that regardless of the position that you select or the field that you will work in, you're going to come up against substance use at some level. So it's important to see the signs and be prepared for that. Remember that the damage caused by or related to alcohol and other drug problems permeates a person's life. It's not as, in air quotes, simple as abusing a substance, right? Substance abuse affects every area of life. It often also affects the lives of family and friends, and it does so without discrimination. We're going to come back to this idea and the idea of looking at it as a tree with roots throughout the semester. So keep it in mind as we discuss different aspects of abuse. So what are philosophical orientations? These are ways that different professions think about and explore alcohol and drug use. And so, for example, again, we're going to take an example from your book. It's on page 4. This is under the philosophical orientation piece. Let's take a look at Jerome. Jerome is a 47-year-old African-American man who has been arrested for a DUI, driving under the influence. It was his 3rd DUI, and he had previously been in an alcohol treatment program. He had been arrested for writing bad checks as well as spousal abuse in the past. He is unemployed and dropped out of school in the 10th grade. An assessment revealed a long history of alcohol and drug use, beginning at age 12. Jerome's mother was an alcoholic, and he was raised by his grandmother. He does not know his biological father. So Jerome's problems may be viewed in a number of different ways by different professionals, depending on their training and their experience. A sociologist may focus on the environmental and cultural factors that modeled and encouraged alcohol and drug use. A psychologist might attend to the fact that Jerome experienced rejection by his biological parents that led to feelings of inadequacy. A psychiatrist might say there's a genetic predisposition and a family history. Someone from a religious background might say this is due to weakness right? Or a character defect. We'll talk more about this when we discuss models of addiction. And a social worker might say, due to his unemployment and lack of education, this all led to his alcohol and drug use. This is another reminder that there are many viewpoints in the case of human behavior. The point is that it requires you to stay open to the wide variety of causes that lead to alcohol and drug problems. And there are as many and equally wide and varied methods to respond to this in recovery. Like philosophical orientation, professional orientation is also going to differ. There are a number of factors that will contribute to how you use this information in your chosen profession, from personal experience with the topics to when in your college career you're taking a course or to your eventual job placement. But what I'd like you to think about, regardless of your professional or personal goals, is really not to filter your thinking through this lens. Whether it's, I don't need to know this because I won't be dealing with that in my career or my personal life. Or I don't believe that. It doesn't fit into my human behavior, my view of human behavior. Instead, remember, this is a very prevalent problem in society. And if you're going to be working with people, you are likely going to come across substance use disorder. So what I'd like you to do is challenge what is presented to you, but keep an open mind and think about what this means for how it affects you and how it affects how you interact with others. I especially encourage you to think about your pre-existing beliefs and thoughts about alcohol and other drugs, and reflect on this as we grow together throughout the semester. This is really important because many of these can be unconscious, right? So we have our attitudes, our beliefs, and our biases. We all have them, for better or worse, they're there. Some of them are conscious to us and we understand them, and others are less so. What can happen with these attitudes, beliefs, and biases in working in a helping profession is that these beliefs can lead to misdiagnoses. And further, they can lead to resistance and dropout. And how do they do that? Well, they do that because if these judgments show in the way that you interact with people that you're working with, they may not want to come back. People don't want to feel judged. So what I want you to think about is that we are influenced in ways that we don't realize in our day-to-day lives. To illustrate this, let's take a look at a study that was done at Yale University. This also will refer back to that article that I put on Sakai for you guys to read. But basically what this study did is it took a look at what impacts decision-making when you're conducting an interview. So what they did was they had people come into an interview, approach people in different ways. And they were looking to find out, could it be things that you don't even think about, right? These decision-making points that impact you. So what they did was they had people coming in holding either a cold or a hot beverage. And what they found is that those holding hot drinks were more positively thought about by the interviewee than those holding cold drinks. Is it a rational thought? No, it's not. But we think about things in a certain way, right? We hear the term warm smile and it indicates something to us, right? Or a cold heart. We're influenced by things and in ways that we don't even realize. And that's what this study was trying to show us. So I want to point out that this is not necessarily a negative trait, but a necessary one. Think of the saying that it's better to be safe than sorry. An example, if you sense something coming at you, you duck or you swerve. This is a decision that you make that is hardwired into us, right? You don't want to be hit with something. So earlier in history, these were often life or death kinds of decisions. If you were out hunting and a hostile animal were approaching, if you didn't act quickly, you could die. So these kinds of thought patterns evolved our minds to make very quick decisions, often before we've even had a chance to think about it. This hardwired pattern of decision making is based on what feels safe, likable, and valuable, among other things. And we don't even really recognize or think about it. So looking at this slide, what does this say? Scientists estimate that we are exposed to as many as 11 million pieces of information at any one time, and our brains can only functionally deal with about 40. How do we filter out the rest of this information? Through filters that depend on our own perceptions, our interpretations, our preferences, and of course, our biases that we have adapted through whatever point we are in our life. So we make assumptions about what is real in every moment. We sort through those 11 million pieces of information and we see what we see. We believe what we see because this is our personal view and we believe that this is real. Only occasionally do we realize how subjective those determinations are and how much they are impacted, not by what is right in front of us, but what we interpret is right in front of us, seen through our very own lens. Our perceptions are so deeply buried in our unconscious that even knowing that it's there makes it difficult to see its impact on our thinking and on what we as individuals see as real. In other words, it doesn't make it more conscious. It's still there, and it's still working on us in unconscious ways. So taking in all this information, right? What if these perceptions drive how we interact or treat patients that we work with? It's important to recognize unconscious biases and the roles that they play in our attitudes, beliefs, and perceptions every single day, even when we make small decisions and we have small interactions. So I'd like you to try something. I'd like you to take a minute and visualize your picture of an alcoholic. You're alone watching this, I'm guessing. So close your eyes if it helps and just take a minute and really think about it. What does an alcoholic look like to you? Jot down a few words, jot down a few ideas that came to mind. And again, you don't have to read these to anyone. No one knows. So this is just between you. But what are some of those words? What kind of things came up for you? This is not about judgment. This is basic understanding. So a lot of people picture the alcoholic to be a white male, middle-aged, who looks pretty seedy. Someone you would consider you'd see on the street, a stereotypical Skid Row bum. In many of my classes, students have used the father from Shameless as an example. So we know that is not true, right? It can happen to anyone. And frankly, there are many people with endless resources that may never end up in that kind of position. Someone is always there to help them get back on their feet or to never be seen in that light. So think about this, again, without judgment, but what does it mean to you? So we're going to run through a few exercises on the next slides. Now, I'm not with you, so I'm not going to be checking your work, but I encourage you to use this time where you don't have to sit in the classroom and think about it, right? Learn from these exercises because you can bring these things with you throughout class. So the first one's a math problem. What I'd like you to do is take out a piece of paper and using one continuous line, change this number that you see on the screen from a 9 to a 6. I'm going to pause here for a minute because I'd like you to actually do it. Press pause if you need to pause longer, but I'm going to move on. What did you come up with? Here's an answer. It's the answer that is meant to be with this. There is one other option, actually, which is to put an S in front of the IX. But our tendency is for our mind to continue with the same set of rules that we were operating in. And because the number that we started with was a Roman numeral, that is how we continue to think. Why do we do this? Well, it's to make you think about what are some of the rules that you operate in that might limit the way that you think about things. It's just another way to open your mind. Here's another example I'd like you guys to try. I want you to take 10 or 15 minutes and write about a key event that happened in your life. I'd like you to think back as far as you can remember. In something, an event, whatever stands out to you, that may have impacted how you engage with the world. How might they impact your relationship to trust, these events? Your relationship to safety and the way that you relate to others, like authority, for example. How might it impact how you behave in the classroom, at school in general, or in the workplace? Use the example in the corner. It's a very brief example, but it might help you think about things a little bit. Again, I really encourage you to take 10 or 15 minutes to do this and write it down. I'm going to ask you to bring it to class, and we're going to talk about it next week as the opener for class 3. So please do that and take your time and think about it. You can pause here before going on. If you go to page 6 and 7 in the book, I'm going to do a little bit of reading again. It's the bottom of page 6 if you want to read along. So imagine, or maybe you don't have to imagine, that you're in love. And you're in love with someone that you believe to be the most wonderful person in the world. You cannot imagine living without this person and firmly believe that you need this person to survive. Your mother sits you down one day and tells you that you can no longer associate with this person. She tells you that this person is destroying your life and that you may have changed since becoming involved with this person. That all of your family and friends believe that you need to break off this relationship before something terrible happens to you. How do you react? You might tell your mother that she's crazy and that all of her complaints about this person are untrue. This is denial. Perhaps you acknowledge that the person does have some quirks, but they don't really bother you. Minimization. You tell your mother that she and the rest of the family and friends that are talking about this are really jealous because they don't have someone as wonderful as you do. This is projection. And that you may have changed, but that these changes are for the better and they are long overdue. This is rationalization. So these are defense mechanisms. And for those of you in psychology, I'm sure you've talked about these before. And they're used so that the person does not have to face the reality that they find incredibly terrifying. And that is a life without alcohol or drugs. So I want you to keep these things in mind. These are important concepts, but I really want you to keep them in mind when you give something up for the class. I want you to think about when these things come up for you and record your feelings around them, right? You know what they mean. Some of you, again, have heard them more than others. But think about them. And when you catch them through that month, how did it feel? What was it like to recognize you were using one? And how did it feel for you as these things came up? This is something to consider when you're writing your paper. I think that is all for the first chapter, so we're going to move on to the first part of chapter 2 next.